Hi, my name is Dr. Sarah Parrott, and thank you for watching this video in which we'll go through the heart and lung exams, which will be required for all Year 3 CSA cases. The heart and lung exam, again, are required for all Year 3 CSA cases. So depending on whether you're doing whatever case you're doing, you should watch this one first. So modeling for me today is my son, Robbie. Hello, Robbie.
Hello.
Say hi to the standardized patients who will be watching this all over the country as they're training. So what we're going to demonstrate first is the heart exam, and the most important thing is that they actually listen over the areas that they should be listening on. So we'll review that. I know that you all know this, but we'll go ahead and review that. I do need to listen on bare skin, so would you like to undo your gown or do you need assistance?
Oh, I need assistance.
Okay, so let me go ahead and undo your gown, and then we'll just bring it down. You can go ahead and hold it right there if you'd like. You can just, put your hands here or whatever. Okay, there you go. Okay, so basically we're going to listen to the valve. This is the chest bone, so we're going to listen to an area about 2 inches from the top of the chest bone, and then 2 inches on the other side. So 2 inches, inch or two, about there-ish and about there-ish on both the right and the left of the chest bone. Those are for the aortic and pulmonic valves. So I'm going to listen, and they may instruct the patient to just breathe normally. Okay. The next valve I need to listen to, I'm going to put this up. The next valve I need to listen to is about right there-ish. It's about 3 to 4 inches below the area on the left that they already listened to. So there are 2 ways they can do this. They can kind of drop it down through the gown and guesstimate where that is and hold the stethoscope from the outside of the gown. And we'll show you another way they can do it later. Then for the fourth valve, the mitral valve, that's about under the left breast. For a man, it's going to be just kind of a little bit inferior to or under the nipple, below the nipple. And so one of the ways that they can do that is say, I'm going to go ahead and listen from the side of your gown. So can you bring this gown forward for me and hold it out of the way? Then they should actually visualize where they're placing the stethoscope, and it should be about right there-ish. So for a woman, so they can then lower the gown after they visualized it. For a woman, they may ask you, could you hold your breast up and out of the way? And then they would put it as close as they can to that area without actually touching the bra or sticking it under the bra. We don't want them to do anything that would involve being anywhere close to any personal areas. Another way that's perfectly appropriate and may have been taught on either campus is that they will say to the patient, I do need to listen on skin, so could you please just drop your gown like that, and then they'll do the same thing. Listen here, listen here, listen here, listen here. Okay, go ahead and place that back up. Now I'm going to listen to the lung sounds, and for the lung sounds, it's basically the same 2 areas that we listen to the heart. So again, sorry, this gown is so big on you. We'll go ahead and listen right here. With an open mouth, please take a deep breath in and out. And we do teach that they need to ask you to do this with an open mouth. They also need to listen through the complete exhalation phase, so all the way out when you're breathing out. Now we're going to go to the back, and I'll show you how to do the lung sounds in the back. In the back, it's important, what we're basically looking for is that they're comparing one side to the other at the same level. So generally speaking, they'll do like here, 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 and here. It really doesn't matter. They need to listen to 2 levels, each side of 2 levels. So basically they'll be putting their stethoscope in 4 places. So it doesn't matter for grading purposes if they listen with a deep breath. Can you take a deep breath in and out? With an open mouth, can you take a deep breath in and out? Okay. That would be okay. It would also be okay if they were to do deep breath in and out with an open mouth. And a little bit lower. And closer to the outside. Either one of these would be correct. What we don't want them to do is compare on one side, one level, to that same side, another level. So this would be incorrect. With an open mouth, can you take a deep breath in and out? And he's probably about to faint right now because this is a lot of deep breathing in a row. Yes, so that would not be acceptable. So as long as they're comparing one side to the other, that would be acceptable. So we encourage them after they're finished to tie the gown back up. Some of them don't remember. It's certainly not anything that they're required to do, but if it makes you feel more comfortable to have your gown tied, then it's absolutely okay to ask, would you mind tying my gown back up? Because we want you to be comfortable through the remainder of the exam. So this is the heart and lung exam. Again, this is required on every case that we test for year 3 CSA. Thank you very much.